Good morning and welcome to our Zoom education session on understanding denial and lack of insight in dementia. Thank you for joining us in this discussion. My name is Chris Van Leuven and I'm an education coordinator here at the Alzheimer's Society of Peterborough, Kawartha Lakes, Northumberland, and Haliburton. And joining me today is another member of our education team, Hallie Grady, who's going to be collaborating with me this morning to bring you this presentation. We recognize that throughout our discussion today, there might be several questions that come up. And just in the interest of time, and because I'm not always able to see the chat when I'm sharing my PowerPoint screen, we'd like you to please hold your questions until the end of the presentation. But you can always feel free to jot down a question in the chat so you don't forget to ask at the end. We'll go through the questions that are in the chat at the end of the presentation, and we thank you in advance for your help with this. What are we going to be covering today? Here's a little overview of our presentation. We're going to start by answering the question, what is denial? We'll look at the definition. And we're going to introduce you to the term that you may be familiar with, or maybe not, anosognosia. And we'll talk a little bit about confabulation. We'll talk about some challenges when it comes to caring for somebody who has dementia and is dealing with anosognosia as a symptom. And we'll talk about the care approaches that you might find helpful. We'll also kind of explore what happens when family members might deny a diagnosis of dementia. And we'll talk about how we can help and how we can support each other. So first off, what is denial? Well, the dictionary definition of denial is the refusal to admit the truth or reality. And when it comes to psychology, we consider it a defense mechanism in which confrontation with a personal problem or with reality is avoided by denying the existence of that problem or reality. When we say that somebody is in denial, it means that they're refusing to admit the reality or truth of something unpleasant. For example, a person in denial about their health problems. It's really common for people who are newly diagnosed with dementia to experience feelings of disbelief and denial. They might express thoughts like, this can't be happening to me, and it isn't as bad as the doctors say. In the beginning, denial can be a really positive force because we use it to shield ourselves from news that might be too painful to bear. And we do that just in the time that it takes to inwardly adjust to our new reality. However, living in denial will not help you to live well with dementia. What are the reasons for denial? Well, we have 5 different reasons that somebody might be in denial up on our screen. And as I mentioned, the first one is that denial is a coping mechanism. Someone who's newly diagnosed with dementia might have difficulty accepting that reality. And denial can help us to deal with grief and feelings of loss that might come with a diagnosis of dementia. The second reason is that the person might not have noticed their symptoms. They may not realize that their symptoms are getting worse. And they might be unaware of the more subtle changes in their abilities. In fact, the person living with dementia might not notice those early symptoms of their diagnosis, whereas the other people around them do notice. It's the people sometimes closest to us that notice those changes or find those changes more apparent than we do. Furthermore, difficulties with memory and the retention of new information related to dementia might have caused the person to forget their diagnosis. It's also possible that a person might try to rationalize the symptoms that they're experiencing and explain that they're, completely normal. Because in the early stages of dementia, those changes in memory that you might see, for example, can be brushed off as just a completely normal part of aging. Lastly, stigma associated with dementia might make the person hesitant to accept their diagnosis. Unfortunately, a deep lack of understanding still exists when it comes to dementia. There are many widely accepted myths about what it means to have dementia, and people living with dementia often experience discrimination simply on the basis of having the disease. Out of fear for the types of reactions that they might receive from friends or family, the person might be reluctant to talk about the changes that they are experiencing, and they might delay sharing that they have dementia. From an outsider's perspective, this withholding of information, keeping the diagnosis a secret, or the person's refusal to admit that they're living with dementia may look like denial. Now that we've had a chance to define denial and explain some of the common reasons for denial when it comes to dementia, we're going to define and explore the concept of anosognosia, which is another way to understand the lack of insight that might be apparent in dementia. And I'm going to pass things over to Ali now to get us started with that.
Thanks, Chris. So we're going to introduce two big words, anosognosia and confabulation. And we're going to break them down so it's not as complicated. So anosognosia is a bit of a mouthful to say, but it is a term that is completely translatable when we break it down. So the A in anosognosia means no or not having any. You see this in other words like atypical, right? You've got typical, and then A means not typical, atypical. Nosos means illness, and gnosia means knowledge. So directly translated, anosognosia means no knowledge of illness. A person with anosognosia has no knowledge of their illness, what we commonly refer to as a loss of awareness or insight. The person with dementia doesn't know that they don't know, and they often forget that they forget. So you might be wondering, what's exactly the difference between anosognosia and denial? Well, anosognosia does differ from denial. And as Chris mentioned earlier, denial is a psychological phenomena and a coping strategy. People often use denial to ignore, to avoid, or reject something because it's too difficult or it causes too much stress. And the person may minimize a problem or only accept part of the truth. For example, the person may accept the fact that they are chronically ill, but may avoid dealing with it by not taking medicine. Anosognosia, on the other hand, is a condition that results from physical changes and damage in the brain. Typically, it's in the prefrontal lobe of the brain, so that's right behind our forehead, kind of the front and top part of our brain. And the parietal lobe, which you can see in this picture, is kind of just above the ear. And research has shown that anosognosia often is caused by physical damage on the right side of the brain. So in short, the difference between anosognosia and denial is that anosognosia is caused by physical damage to the brain and therefore is anatomical and physical in origin, whereas denial is psychological in origin. Anosognosia is common in dementia, especially as the person moves into the middle and later stages of the disease. As we mentioned, it's a direct result of physical changes or damage in the part of the brain that affects perception of one's own illness. And this means that no matter how much you argue or reason with the person, they cannot appreciate or understand their condition, and it's not their fault. Their brain has changed in such a way that they are physically incapable of insight into their illness. Every person with dementia is unique. And some people are aware of the changes in their functioning and may even be able to tell you, I have Alzheimer's disease. This is more common in the early stages. In the early stages, there may be problems with short-term memory, the memory of what happened 5 minutes ago or what you ate for dinner last night, along with decision-making and judgment. However, language skills like speaking, spatial skills, knowing where the body is in space, and math skills may remain until later on in the disease process. As dementia progresses, anosognosia may progress as well. The person who used to have some awareness into their condition and the changes in their abilities may lose that awareness. And they may have a hard time accepting help, saying things like, I've been showering myself my whole life, I don't need your help, or I've been driving since I was 16, I can still do it. I'm going to pass it back over to talk to a little bit more about self-awareness.
Thanks, Allie. So as Allie was just mentioning, the symptoms of anosognosia may progress as the person's dementia progresses. So the person with dementia might be slightly unaware of their dementia and changes in abilities, completely aware, or somewhere in the middle. This might fluctuate day by day or even from one moment to the next. This is normal. Over time, the person may lose more of their self-awareness as the brain continues to change. So now we're going to talk a little bit about that second term that Ali had mentioned, so that second big word, and that's confabulation. So perhaps the person with dementia in your life has started making up answers to your questions that you know to be false. Is the person lying? The short answer is no, it's not lying, it's confabulation. The purpose of a confabulation is not to mislead and it's not to lie. Confabulation is making up an answer or responding with remarks that link pieces of information, time, places, and people that don't really belong together. For example, if you ask the person with dementia what they did today, they might respond with, well, I went to work, when you know that that person retired 10 years ago. It's not so much that the person with dementia is lying. They may truly believe that they are younger than they are and that they went to work today. In these situations, it's not helpful to correct the person or to reorient them to our reality. Instead, we suggest that you use validation. So you might say something like, oh, well, how was that? Or it must have been a busy day for you today. And you'll find that this approach creates less conflict and allows for more opportunities to reminisce. And we're going to talk a little bit more about validation a little later on in our presentation today. So for the next section, we're going to talk about the different challenges that we might come across when caring for somebody who's living with dementia and experiencing anosognosia. And we're going to talk about some care approaches that might help us to support the person. So here are some of the common challenges that care partners might notice. The first one is refusal of medical assessment. The person with dementia might not notice physical or cognitive issues that require medical attention or intervention, so they might refuse to go to the doctor or to go to the clinic. They might also refuse to take their medications or to participate in things like physiotherapy because they don't think that they need it. The person's not intentionally trying to be difficult. Their brain is telling them that they are fine, so they believe it, just as we believe the information that our brain tells us. The second common challenge for care partners is that the person might become angry when their deficits are pointed out. If the person is unable to appreciate their diagnosis, they may react poorly when we point out those deficits. No one likes being told that they can't do something, right? Especially when in our heart of hearts, we believe that we are capable. Third challenge is those safety risks. So when somebody is experiencing a lack of awareness, things that they could formerly do with complete confidence become more challenging. So common safety risks for somebody that has lack of awareness are fire. Maybe cooking is now a challenge for the person. There maybe have some difficulties with attention and difficulties maintaining their attention in the kitchen. Falls are another common risk. Frailty, as we age, we become maybe more frail and more likely to injure ourselves. And firearms. If there's firearms in the home, the person's lack of awareness may prohibit them from realizing that they're not quite as capable using those firearms safely as they used to be. The fourth item on our list here is poor personal hygiene or resisting care. A person living with dementia may begin to exhibit poor personal hygiene. So they might stop taking care of themselves in the morning. They may forget to brush their teeth. They may begin wearing the same clothes day after day, or they may stop bathing. When asked if they'd like some help with those personal care tasks, the person might become angry. Confabulations might arise, like, I don't know what the big deal is, I just showered yesterday, when the person really hasn't bathed in a week. Again, the person is not lying. Their brain is telling them that they just showered yesterday. The last item on this list is that the person might be unaware of how their behavior affects others. So because of the lack of awareness or insight, a person with dementia might not recognize when something they say or do is hurtful or not socially acceptable. So what can we do when we experience these challenges? On the slide, we've listed 5 care approaches that can help. So using a positive approach to communication, providing a structured routine, downsizing responsibilities, working together, and staying calm and focused. And we're going to go a little more into depth about these on the following slides. What do we mean when we say a positive approach to communication? Well, we mean that it's important to come into the conversation with feelings of patience and kindness. Also, validating the person with dementia's reality, not dismissing or correcting it, and focusing on the person's strengths, what they can do instead of their deficits, what they can no longer do. When a person has memory loss and loss of insight and awareness due to the changes in the brain caused by dementia, it's important to recognize that the person may experience a reality that is different from our own. Validation requires that we step into that person's reality to see the situation from their perspective, even though it might not necessarily correspond with our here and now reality. It's helpful to validate how the person is feeling in that moment in time to respond in a respectful and supportive way to their emotions rather than correcting the facts of what they're saying. It's important not to dismiss, minimize, or ignore the person's perspective, feelings, or experience. Their perspective of the situation, combined with the emotions that they're feeling, are very real to them. They may also be responding in a particular way because there's an important need that they're experiencing that isn't being met. When we use validation as a communication strategy, we enhance rapport, trust, and safety in the conversation. And we provide an opportunity for the person to be successful. As dementia progresses and the person's abilities change, we may need to change our approach to care and seek some additional support. But it's important if we can frame these changes as positive, and it's helpful if we put an emphasis on the person's quality of life. So it might be helpful for us to start to provide structured routine and assistance, because having a routine can be beneficial for all of us, including people living with dementia. You might find it helpful to set certain days as bath days or as social days, outing days, or appointment days. You might choose to have meals at a specific time each day. And these routines provide a sense of familiarity and comfort to the person living with dementia. When we talk about using positive communication to introduce this strategy, you might say something like, after we walk the dog, we're going to finish the laundry and then sit down for lunch. It gives them a sequence of events to help structure out their day, and so that they know what to anticipate and what's coming next in their daily routine. Another positive approach to care is to downsize responsibilities. Sometimes we expect too much from the person with dementia. Be honest with yourself about what household activities and responsibilities the person can still manage, and offer to assist or take over those tasks that they're finding too challenging. You may want to consider downsizing your own responsibilities as a care partner as well. And you can do that by seeking assistance from family, friends, neighbors, or agencies for things like meal preparation, house cleaning, yard work, or transportation. And when you broach this topic with the person living with dementia, you might find it positive to say something like, it's time to plan ahead about having someone to do the yard work so you have more time to do what you like. And there again, you're placing the emphasis on the person's quality of life. The next positive approach to care is to work together. So this means working together both with the person living with dementia and with other members of the care team. So that could be other family members who help to support the person. That could be doctors or medical professionals like PSWs as well. You don't have to do it alone, and it's important to include those people in the conversation. A positive approach might be to say something like, to keep up with these bills, we should work as a team. I'll come over on Saturday with coffee and we can help write out the checks together. So you're supporting the person by offering to help to do something with them. This last positive approach to care that we have on our list is to stay calm and focused. If you find yourself or the person living with dementia getting worked up, it's a good idea to stop, take a deep breath, and maybe suggest a break. If you offer to make some tea or maybe suggest going for a walk, those are some easy options. When you go into a conversation, consider sticking to one topic or question at a time. Switching topics or listing too many steps at once or asking too many questions can maybe cause confusion or frustration for the person living with dementia. You can keep it simple just by sticking to one thing at a time. A positive approach might be to suggest something like, when you take this multivitamin, how about taking these brain vitamins the doctor prescribed to keep your memory strong? And that's just a good way to introduce the person's medication to them in a positive way. If you'll recall, a person who's experiencing anosognosia can have different levels of that self-awareness. So they can range from aware to slightly aware to completely unaware. And you might take a different care approach depending on the person's level of insight and awareness. For a person who is aware, their reaction might be sad, it might be tearful. And our solution as a care partner is to offer help and assistance as needed, provide that reassurance, and do what you can to help decrease the person's anxiety. For someone who is slightly aware, their reaction may be paranoid. Our solution is to continue to offer that reassurance and help or support if needed. For the person who is completely unaware, their reaction might be anger. First and foremost, we need to make sure that everyone involved is safe. This might mean giving the person space or removing them from the situation. So for example, if you happen to be out in a busy shopping mall, it might be time to return to the car or just going outside for a little while. Or it might mean removing yourself as a care partner from the situation to give the person some time to cool down. You might say something like, I can see this is really frustrating, which is validating that person's emotion. I'm going to go make a cup of tea and maybe we can find a better solution when I get back. I'm going to pass things back over to Ali now, and she's going to talk about the way that family members might react when a loved one is diagnosed with dementia.
Thanks, Chris. So we've talked a lot about denial and about the person living with dementia who's experiencing that loss of insight or awareness. But what if they're not the ones that are experiencing these symptoms? What if it's the family members or care partners who are denying? Let's look at this a little bit further. There are many reasons why a family member might deny that a person has dementia. And here's just a few of them. Number one, they might hope it will go away. They might hope that the person will eventually get better. And unfortunately, we know that currently there is no cure and that dementia is a progressive degenerative disease that does not get better with time. The second reason that a family member might deny is that they rely on the person with dementia, whether it's physically, emotionally, or socially. They might rely on that person to do the grocery shopping, the laundry, or meal preparation. Maybe they're the one in the house who can pay all the bills and who, is the one who drives. By acknowledging that the dementia is real, family members have to come to terms with the inevitable shifting of roles and responsibilities. Number three is that if they don't visit regularly. So sometimes family members don't visit the person with dementia regularly, so they don't see those subtle changes in the person over time. And they may deny any changes because the person appears well when they do visit. Or if even over the phone, maybe it's a quick phone call, and often what's preserved in dementia is that banter back and forth, the hi, how are you? Good, how are you? So the person can still seem like they don't maybe have dementia when they do. Another reason a family member might be in denial about a dementia diagnosis is fear about the future. So again, acknowledging that the dementia is real means coming to terms with inevitable changes and a decline in the person's functioning. And this can cause a great deal of fear and anxiety, especially about the future. Now, unfortunately, when a family member denies the existence of dementia or denies a diagnosis, it does carry some risks. And some of them are quite substantial. So we mentioned this earlier, but an accident and or an illness. So without appropriate intervention and support, there is a risk that the person with dementia will have an accident, whether that's, leaving a tea towel on a hot stove causing a fire, or forgetting the rules of the road and getting in a car accident, or going out for a walk and losing one's way and getting lost. And this is due to brain changes in reasoning, decision-making, and memory. It can also mean that a person may not seek medical help for a problem that needs attention. So perhaps they had a fall and they potentially have a bone fracture or a sprain, but they either don't remember or they don't seek help for that for some reason. Another risk of when a family member is in denial is family conflict. When some family members accept the diagnosis and others deny it, disagreements and conflict can ensue. And this may heighten tension and stress between members of the family. Third is lack of medical intervention or treatment. While medications for dementia are not a cure, they may slow the progression. And the key to successful treatment lies in early intervention. The earlier, the better. So denying the diagnosis means that the person with dementia is not able to start treatment in a timely manner. There's also the risk of financial exploitation. We are all at risk of falling victim to scammers, whether that's on the computer or on, the phone. However, a person with dementia may be more prone to falling victim to fraud as their reasoning abilities change and deteriorate. There's also, we hate to think of this, but there is the potential that close family members or friends may take advantage of the person with dementia and find themselves in a situation where exploitation is taking place. The fifth risk we've listed here is stress for the primary care partner. We know that caring for a person with dementia can be challenging, and the more people, whether that's family, friends, neighbors, community organizations, that can assist the person with dementia, the better. So by denying a diagnosis, more pressure is put on the person with dementia and their primary care partner, which can lead to stress. So what can you do? How could you help a family member who is experiencing denial? First, a family meeting may be beneficial. We recommend that you set the scene, pick a time when no one's in a rush, maybe make a pot of tea or coffee, put away distractions, maybe that means your cell phone, and ensure that you won't be interrupted. Second, give some space for everyone to express their concerns and their fears. Acknowledge these concerns without judgment, even if you don't agree. You might say something like, I can understand where you're coming from. That behavior would concern me too. Third, explain the implications of denial. And you may want to mention some of the risks that we've talked about today, such as the potential for accidents or exploitation or stress. Fourth, provide support where you can. You might offer to get groceries, help with yard work, or take the person with dementia out for a drive so that the primary caregiver has some time to relax. Let the care partner know about the education and services provided by the Alzheimer's Society, which is free of charge without a doctor's referral. And also know your limits. If the person who's in denial is still in denial after having a conversation, know that a professional counselor might be an option. And if they won't go, you can go to discuss and work through your emotions. Sometimes as care partners, we get caught up in our own feelings and experiences, and we can forget about the feelings and experiences of the person living with dementia. So we thought we'd finish off by looking at some of the insights from people living with dementia. I still need my friends and family. Dementia doesn't change that. Don't pretend that nothing is wrong. Acknowledge my disease. Don't treat me like a child. It's a big one. And learn about the disease. The more we know, the more we can plan and cope in the future. Let me continue to do the things I can still do. Don't stare at me strangely. Take time to listen. Give me some space. And give me time to do things. Most of all, remember me, the person outside of the disease. We know that living with and/or supporting someone with dementia is not easy, and we want you to know that you are not alone and that the Alzheimer's Society is here to help. We have a range of supportive services designed to assist you in your dementia journey. And please do not hesitate to reach out to us if you have any questions or you'd like some more information or resources, or to speak to a client support coordinator about what you're going through. I want to thank you so much for joining us today for our presentation about lack of insight and denial. We hope this information was useful for you. And I'm going to stop the recording now so we can take some questions.